Hi guys, my name is Annalise and I work with Dr. Darren Smith. Dr. Darren Smith is a board-certified plastic surgeon on Manhattan's Upper East Side. And today I'm just going to talk to you a little bit about breast augmentation, what the procedure looks like, consists of, and what you can expect to discuss in a consultation with Dr. Smith. So breast augmentation is one of the most popular procedures that Dr. Smith performs, and with beautiful results, rapid, comfortable recovery, it's easy to see why it's such a popular procedure. While ultimately the desired look is a very personal decision, Dr. Smith does specialize in natural results that complement the individual's shape and size. Dr. Smith does use an advanced 3D imaging technology to simulate the results and help choose the best implant for each patient. So when we talk about breast augmentation, there are three major decisions that need to be made. These three decisions are what kind of implant, how the implant is placed, and where the implant goes. So I'm just going to briefly go through those three decisions with you one by one. So what kind of implant? There are silicone implants and saline implants. Silicone implants. 95% of all cases use silicone implants as they look and they feel the most natural. Some people do prefer the idea of having a saltwater implant over silicone, so that's why you'll see some people choose saline over silicone implants. How is the implant placed? There are three different ways that the implant can be placed, three different main ways the implant can be placed. Through the inframammary incision, which is an incision in the fold under the breast, which is used in the majority of cases. It's a scar that's very difficult to see, and it also carries the lowest risk of infection and the lowest risk of capsular contracture. The second way to insert the implants is the periareolar incision, which is an incision at the border of the areola and the regular breast skin. With this, you run a greater risk of an unfavorable scar and a higher risk of infection and capsular contracture. And the third way that the implant can be placed is transaxillary, which is an incision in the armpit. So there is no scar on the breast, but this does carry higher risk of infection and capsular contracture, and it gives Dr. Smith less control over the breast shape. And the third decision, where the implant goes. Under the pectoralis muscle or over the muscle are the two options. Most often, the implant is placed under the muscle, which looks and feels the most natural, and there is a lower risk of capsular contracture with this method. If the implant is placed over the muscle, typically it's placed over the muscle in patients that are very muscular, because contraction of that pectoralis muscle can change implant shape and size. So that is one reason why some surgeons will opt to put the implant in front of the muscle or over the muscle. So there are some quick facts on breast augmentation procedure. While there are many decisions to make, it will be our pleasure to guide you along in the process to achieve an excellent result that you'll love. I hope you enjoyed this video. There will be more to come. Thank you.